Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is November 20th, 2020. As always, we start with COVID-19 statistics. Worldwide, we have nearly 58 million cases and nearly 1.4 million deaths. In the United States, we have over 12 million cases and over 260,000 deaths. This past week, we've had over 150,000 new cases every day in the United States, sometimes well over that. Yesterday, there were nearly 200,000 cases. Hospitalization numbers continue to rise, and some hospitals are reaching critical thresholds where they're having to turn some people away. The increased hospitalizations prove that our increased cases are not just because of increased testing. More people really are getting sick, some with severe, long-lasting symptoms, and more people are dying. There's been a lot of news about public health this week. We definitely can't get to all of it, and I actually want to focus the report this week on something else, so we'll only mention some of the news, and then you can check out the links below the video for the rest. The first bit of news that I want to mention is that Moderna has now released preliminary results, and they show nearly 95% effectiveness for their vaccine with no major side effects. That means that we now have two COVID-19 vaccines that are basically ready to go and showing over 90% effectiveness. They both still need to gain authorization from the FDA, but that's expected within the next few weeks. With both companies working hard to produce as much vaccine as possible, it's estimated that about 22.5 million doses will be ready by January. That's a lot, but it's still less than 10% of the population of the United States and nowhere near enough for the whole world. We should have a lot more doses by spring and summer of 2021, due both to increased production from Pfizer and Moderna, and also due to more companies that are creating vaccines having their vaccines finish all the phased trials and getting approved. But it may still be quite a while before we have enough vaccine in the world, or to get to everyone in the world, or even just to be enough to kickstart the herd immunity. The other bit of news I want to touch on is that the American Medical Association, or AMA, has officially recognized racism as a public health threat. Now, this is something that all public health professionals have known for years, but it is very refreshing to have a major public health organization come out and officially take that stance. As part of their announcement, the AMA listed quite a few new policy changes to further support the fight against racism. They also designated race as a social construct, meaning it's not something that's innate in people, but was instead created by society. Many of us may not understand how that could be the case, since it's so ingrained in our society that we've just kind of become accustomed to it being something that we think is natural. But race is different than ethnicity, genetic ancestry, or biology. An easy way to distinguish those things from race is to look at someone who is quote-unquote multiracial. Take me, for instance. My genetic ancestry is from England and Scandinavia on my father's side, but from Spain and Italy on my mother's side. My biology is hard to define because each person is different. We have different body types, different susceptibilities to certain diseases, and too many other biological differences to mention. My ethnicity could be described as white American, based on where I grew up, or white European, based on my ancestry. But my mother was born in Argentina, and so my ethnicity has been influenced by that culture also. So I could be referred to as Hispanic. My wife is from the Philippines, from a mixed genetic ancestry, some Chinese, Spanish, Filipino. And so my children are very mixed. They have a very mixed genetic ancestry. Each one of my children has slightly different skin coloring, facial features, and other physical features that make them unique. If people would guess their race just from looking at them, some might say they're white, some might say they're Hispanic, others might say Filipino or Asian. Everyone would be partly right, but everyone would also be wrong. No one in this world is purely one race or of a quote-unquote pure genetic ancestry. We're all mixed one way or another. There's no reason to divide ourselves by race. We should embrace differences in cultures, enjoy new experiences when we meet people that grew up a different way than we did, and we should learn from everyone. I'd now like to move on to the main focus of this report, how to deal with COVID-19. Now, we've already talked about things that we can do personally to slow the spread of COVID-19, and we need to continue doing that. But right now, I want to talk about what governments should do. Now, like I've said many times before in previous reports, we here at Plain English Public Health try to remain impartial, politically neutral. We don't want to get into the whole politics of stuff. Some of you may have some issues with the things I'm about to say because they disagree with your political viewpoints. But rest assured that I am basing all of this on scientific studies. It's not supposed to be specific to one political party or another. Some of the studies that I'm basing this on are linked below the current video, and others are from previous reports we've done. So there's still some uncertainty about what the best course of action is to beat COVID-19. Not because we don't know how to beat it, because we actually pretty much know how to beat it right now. There's very little true discussion about that. We know the steps we need to take. But specifically, there's difficulty in deciding what to do because we also have to take into account any unintended consequences such as economic fallout and emotional and social side effects. That's the hard part. At this point, however, we have to do something. The last few months have mostly consisted of a lot of inaction. People just not doing anything, blaming the other people. It just can't go on. We're currently at a tipping point in the pandemic. Early in the pandemic, there weren't that many people who had been infected, so even though outbreaks were pretty bad, say New York, Italy, etc., they were pretty limited geographically. It didn't spread very far beyond those individual areas. Now, however, even rural, out-of-the-way areas are seeing huge increases in cases. Just look at North and South Dakota for an example of that. There's very few people there, especially North Dakota. Very few people who live there, but they're having huge amounts of cases. It's just getting out of control. So here's what we at Plain English Public Health think should happen in order to beat COVID-19. We agree with what Dr. Fauci said this past week that we need a more organized and unified response to COVID-19 in the United States. Right now, the response is a patchwork of mostly ineffective policies left up to the discretion of the individual cities and states. A unified response is essential to beating COVID-19. We're not political experts by any means, but we're sure there are ways to enact far-reaching legislation while still respecting the rights of individuals and the rights of states. We do know that there are provisions in the laws of the United States and in the laws of each individual state that allow more drastic measures to be taken during times of emergency. This pandemic, with over 250,000 deaths in less than a year, definitely qualifies as an emergency. If you think about it, we are less than 35,000 deaths away from the total number of U.S. casualties during World War II, and that war took nearly 4 years. Unless we take drastic measures, we will definitely reach that number before the end of the year. For those who still contend that deaths caused by COVID-19 are much lower, please refer to this year's excess deaths, which are already over 300,000. Something is causing those extra deaths, and I can guarantee it's not car accidents or choking on lollipops. The only thing out there that can cause that much death is COVID-19. The leaders of the United States need to come together and pass legislation aimed at getting rid of COVID-19 as quickly as possible. Despite the many jokes about politicians, many of our government leaders are actually quite smart and really do care about the lives of their constituents. If they would work together instead of fighting like they've been doing, the U.S. government could pass legislation that is directly related to pandemic relief, not excessively expensive, helps those who are the most vulnerable, and still respects our constitutional freedoms. Those who prefer to fight and argue or who refuse to compromise need to realize that allowing their constituents to die just to satisfy their pride or because of their lack of belief in science is 100% not acceptable. If they want to make sure that constitutional rights are preserved, then they'd better start working with everyone else on a compromise that keeps those rights and preserves life. So, what kind of rules need to be put in place? Just those which the science shows are the most effective. We want negative side effects to be minimized, so we should avoid making too many restrictions. First and foremost, we need a mask mandate, and it needs to be enforced. Exceptions can be made for medical or other specific reasons, but in reality, there are very few people who would actually require exceptions. Wearing a mask is very safe. Public health experts have tried for months to encourage mask wearing without resorting to mandates, and it just hasn't worked. People just don't wear masks. A lot of people do, and we are grateful for those people. But there is a huge amount of people that just don't wear masks. At this point, most of us are admitting defeat and advocating for what we know will work, even though people will hate us for it. It's better to make some people angry than for millions of people to suffer or even die just to keep others happy. That's why we need a mandate. Because even those who wear masks sometimes get COVID-19, some people claim that masks don't work. However, multiple robust studies have shown that wearing a mask dramatically reduces your chance of becoming infected with COVID-19. Exactly 0 robust studies have shown that wearing a mask is bad. There have been a few studies that have shown no benefit from wearing masks, but nearly all of those were either done years ago for other diseases such as the flu, or the studies have multiple problems with how they were done, like the one that was just released out of Denmark this past week. Those who are against masks typically point to these types of studies as proof that masks don't work, but they don't understand how scientific studies work. Second, because bars and restaurants are where the highest spread happens, they need to be closed to indoor dining. Curbside pickup and delivery are fine as long as everyone is following the mask mandate and staying far enough apart. In addition to bars and restaurants, other types of places that regularly cause super spreader events, such as nightclubs, gyms, things like that, need to either be closed or have strict occupancy limits enforced. Third, gatherings need to be limited in size. This will vary depending on the number of cases in the area and whether the gathering is inside or outside, but generally speaking, no gathering anywhere should have more than 50 people until the pandemic is brought under control. Fourth, we need to reallocate money and effort to things that actually matter. For example, don't bother with deep cleaning of airports, stores, and other public spaces. Regular cleaning is sufficient for that. Also, even though lockdowns and stay-at-home orders are very effective at stopping the spread of COVID-19, they also have many negative side effects. We need to make it clear that the steps we are taking will remove lockdowns as an option. We won't need them. In fact, the head of the European division of the World Health Organization recently said that if 95% of people who wore masks instead of the current worldwide estimate of 60%, we would not need any lockdowns at all. Another example of what shouldn't be done is the mass closing of schools. Yes, there have been some cases due to schools, but there have been no major outbreaks, and schools are not considered a significant danger. Masks should be required, and social distancing should be practiced as much as possible. But schools do not need to be completely closed. If some schools want to offer online learning, that's great. That's an awesome option. But in-person learning should also be available for those children that need that type of learning. Fifth, because we know that some of the other steps we've mentioned will cause hardships for many people, we need a comprehensive stimulus package. Even with a strong, unified plan against COVID-19 and vaccine availability on the horizon, this pandemic is going to stick around for a while. Any stimulus package needs to take into consideration the ongoing nature of the pandemic. It should include financial support for individuals and families in need, money to help with the development, production, and distribution of vaccines, help for businesses that are facing hardship, and funding for COVID-19 testing, treatment, and contact tracing. There are lots of ways to implement a stimulus package like that, but the point is we need one as soon as possible. The legislative and executive branches of government need to work together and get it done. Civilized society has a long history of making laws to benefit people and society itself. You could even say that that is, or at least should be, the main purpose of laws. When those laws negatively affect specific portions of society, however, the government has a responsibility to help and protect those individuals. The best option would be to write laws that help everyone equally without any negative side effects. In reality, though, that's rarely an available option. It's always going to hurt someone to change something. So, facing the pandemic now is part of our reality, and we need to make sure that we protect everyone adequately. That is the reason for the stimulus package. There's no good reason to stuff it full of stuff that doesn't matter and doesn't actually directly benefit the fight against the pandemic. We need to make sure the bill is comprehensive enough to actually work, so don't cheap out on it or anything. But we don't want to stuff it with stuff that doesn't matter. We need to stay laser focused on what we actually need and make sure we don't have to go in and revisit the situation over and over and over again. As usual, that means finding a compromise between the major stimulus packages currently proposed, and there may need to be new propositions made. As we go about our daily lives, trying to follow the guidelines that will help this pandemic end sooner, please also remember to reach out to your elected representatives to ask them to pass scientifically backed legislation to help the entire nation. I focused on the United States during this report, but the same principles apply in whatever country you live in. Together, we can beat COVID-19. Thank you for watching the Plain English Public Health Weekly Report for November 20th, 2020. Like I said earlier, we've got video links or links below the video to a lot of the information that we were not able to get to today, and there are some links that are also related to what we talked about today. So please check those out. I'm Richard Greenland, and you have a healthy weekend and a happy and safe Thanksgiving.